The relationship between menstruation and infertility.
Today, we're discussing irregular menstruation, specifically sparse menstruation.
What is meant by sparse menstruation?
In normal individuals, the menstrual cycle is around 28 to 30 days. If the menstrual cycle is excessively long, such as 35 or 40 days per month,
or if it occurs every 2 or 3 months, or even longer intervals,
this is referred to as sparse menstruation.
A typical manifestation is having less than 13 menstrual cycles in a year,
or only 7 or 8 times, 5 or 6 times, or even just 3 or 4 times. Such a phenomenon is categorized as sparse menstruation.
Most individuals with sparse menstruation also experience infertility.
Why is that?
Because menstruation reflects ovulation, and sparse menstruation indicates reduced ovulation, or even immature ovulation, leading to reproductive issues. Sparse menstruation
is primarily caused by 2 types of disorders. The first is Polycystic Ovary Syndrome, PCOS,
which we've discussed previously. In addition to sparse menstruation, it also presents with obesity, excess hair, as well as symptoms of high androgens such as oily skin, acne, and coarse hair.
It can also lead to infertility, miscarriages, ectopic pregnancies,
and even biochemical pregnancies. Another type is ovarian insufficiency or premature ovarian failure, resulting from low ovarian reproductive capacity. These patients also exhibit sparse menstruation, alongside secondary symptoms like underdeveloped breasts, lack of distinct female secondary sexual characteristics, dryness, sexual difficulties, and in some cases, thinness.
These symptoms, combined with sparse menstruation,
raise suspicions of reduced ovarian reserve. How do we differentiate between PCOS and ovarian insufficiency?
Symptoms provide a rough distinction. The main diagnosis relies on the hormone profile. For PCOS, follicle-stimulating hormone, FSH, and luteinizing hormone, LH,
including LH/FSH ratios, are usually within the normal range. In patients with ovarian insufficiency, FSH and LH levels are typically elevated. Hence, the latter condition is often referred to as high FSH or high FSH ovarian dysfunction. Other aspects of diagnosis need not be overly emphasized. With the hormone profile and consideration of sparse menstruation, it's possible to distinguish between PCOS and ovarian insufficiency. For PCOS, laparoscopic ovarian drilling can be performed to address the issue, as it involves the presence of testicular tissue within the ovaries. After removal, patients' menstrual cycles usually become regular,
and fertility can be restored.
Effective cause-based treatment options are limited for ovarian insufficiency. The preferred approach is to regulate menstruation using an artificial cycle, promote secondary sexual characteristics development, especially in the uterus and vagina, then utilize egg donation for in vitro fertilization, IVF, to achieve the goal of pregnancy. Beijing Antai Hospital specializes in treating infertility.
We offer a signed treatment approach, with a full refund if no pregnancy occurs within 2 years. This commitment helps avoid wasted efforts and resources, providing an accessible and beneficial treatment model.